started thinking about the decision to purchase technology similar to SafeGait, we looked a lot at the patient population that we had here at Thompson. We looked at what our therapists went through on a daily basis in trying to treat those patients. We would have patients come in with severe orthopedic and neurological impairments, and it would take 2 to 3 therapists at a time to try to do one simple walking task or balance task with that patient. And a lot of times those patients would plateau very quickly because we couldn't challenge them beyond their boundaries without the potential for injury. So we began investigating equipment that could help us to treat patients with those impairments safely and effectively with the least amount of risk of injury to the patient or the therapist, and also with the most productive method without using as many therapists. We looked at a lot of different models. We looked at what they could do. I was in many of the different models to see what they could do, to feel it myself, not only as a clinician, but what would it feel like as a patient. And I was very impressed with SafeGait's abilities. I loved the fact that it moved with the patient. It felt very smooth. It didn't feel like there was a lot of vibrations to it. As a therapist, I loved the fact that it allowed me to have hands-on abilities with the patient without having to worry about the patient having to fall or risk of injury, because I knew the machine would help to catch them. I loved how intuitive it was. So when looking at all of those different pros and cons of the different machines, we chose SafeGait. And since we've installed it, I've been able to see it in action with some of our patients, and it's just been phenomenal. I got to witness a patient yesterday grinning from ear to ear while he was in the machine, laughing, and this is a patient that normally is incredibly nervous during a therapy session. And I just saw him be able to relax and really focus on what he was trying to accomplish instead of being so afraid and anxious about falling. Having SafeGait in our community is going to be a huge advantage. We are going to be the first full-time outpatient physical therapy clinic in New York State to have this kind of technology. That's a huge positive for not only our small community, but for the Finger Lakes region. Oftentimes patients will be able to experience technology like this in long-term care facilities and in rehab facilities right after their injury, but then it falls short in that continuum of care when they get to outpatient because that technology oftentimes doesn't exist. So any gains that they may have made in the rehab facility, they may over time slowly start to not make as many, and they plateau much quicker in outpatient. So having that wonderful continuum of care, having a SafeGait in the rehab facility right after injury through their outpatient care will just be a huge benefit to the population that we treat and a huge community benefit.